go. Hey guys, on the Bowtie Friday. I'm here with Rachel Carroll from the Neuromuscular Studio.
Hi.
It's a group that we work very, very closely with in terms of rehab. She is a neuromuscular certified therapist, and we'll get into what that means here in a little bit. Somebody who we've dealt with since we've moved in here has been a huge supporter of us. We've been trying to be a huge supporter of them.
Thank you.
And all around pretty good person.
Thank you.
Husband likes good beer as well. So
Yeah.
if you need somebody to recommend that sort of stuff, they're good people to do so. But Rachel, first and foremost, thank you for being here.
Yeah,
it's awesome to have you. And then what I want to maybe to talk first about is kind of where you came from. Why did you get into business for yourself? Because you are a small business owner.
Sure.
And what is your background in terms of training? And then we can kind of start dancing around why is that different?
Okay, sure. So I am, my name is Rachel Carroll. I own the Neuromuscular Studio, which is in South Tempe. We have been in business for 14 years. And my business actually started, to give you a little bit of background, I got into neuromuscular work and massage therapy based on personal experience. So I personally went through an injury that I felt had limited results with traditional medical care. I got about halfway through rehabbing my injury, but then it just didn't, I needed something different. I needed a different approach. And so I sought the help of a massage therapist, and that particular massage therapist did myofascial work. I also saw another therapist that did neuromuscular work, and the combination of those two really helped me to progress further and eventually be pain-free. And so that is what led me to change my career path and start massage therapy school, with my own personal experience of being able to get out of pain quickly with those two different types of therapies. Awesome. And it basically opened a whole new world for me. And I really, it was just eye-opening. And so my experience with that prompted me to do massage therapy. While I was going through massage therapy school, I really found that working with trigger points and muscle adhesions and ultimately neuromuscular therapy was my passion. And so when I completed my training and I started my first job with massage therapy, I decided to start neuromuscular therapy training underneath Judith Walker-Delaney. Judith Delaney is one of the founders of Neuromuscular here in America, and she is based out of St. Petersburg, Florida. I did a lot of my training here in Phoenix. We're actually one of the hubs for neuromuscular training, which is pretty cool. Yeah. One of the therapists that I have on staff actually is one of her teaching assistants when she comes into school, or into town. So I started that. That took me about 2.5 years, and then get the certification. During that time, I started my private practice. Started out just renting a space out of a massage suite, and then slowly grew to having my own office, and then grew to hiring a therapist and having a second therapist, and soon was on board as well. So so just a bit through organic time. Started with just regular now we are working with a lot of physicians, physical medicine doctors, neurologists, OBs will send their prenatals in, really painful pregnancy. Obviously physical therapy offices that understand we do, with their patients, and clients when they will tell their friends, and that's kind of how. So 14 years I've been a therapist. Almost 15. The business has been strong, growing since for 14 years now, since 2003. So wow. It's exciting.
So one of the cool things is that I want people to understand is that you got your massage therapy license.
Correct.
And then you go above and beyond to get this neuromuscular certification.
Correct.
Layperson, what is neuromuscular versus regular massage, and why should it be valued differently?
Sure.
Then we'll kind of maybe go into why should people seek out neuromuscular versus just a regular massage that they might get at their local massage place.
Okay. So first and foremost, I am a massage therapist, licensed, trained as a massage therapist. I have all of the massage training that a traditional massage therapist would have, that you would see at a day spa or a massage chain or private practice. The neuromuscular certification is kind of that next step. So it is, it's a highly medical, highly specific modality that takes a lot of time and a lot of training, a lot of medical knowledge. There's as much academic as what there is hands-on, and quite honestly, it just takes a lot of time. Sure. And you have to have that passion and understanding the anatomy, the physiology, the biomechanics, and then practical application as well. So what we do is, the best way that I can describe it would be to parallel it to either a master's or a doctorate versus just a bachelor's. So that's kind of how it's the next step. Yeah. So there are only a handful of us here in town that are certified in neuromuscular work. And the work is much more specific than a deep tissue massage. Deep tissue massage, is great to, relax, do general work, relax the general muscle, but it doesn't specifically target the trigger points or the adhesions that are in the muscle that are perpetuating your pain and also perpetuating dysfunction. And specifically neuromuscular work, what it does is it targets those trigger points. Points are adhesions that are nodules that are in muscle tissue that can be activated and perpetuated as a part of an injury cycle. Perpetuating factors also can be what we call psychosocial, biosocial, also hormonal fluctuations, vitamin deficiencies. Most commonly, we see trauma or repetitive injury as being the cause for trigger points. And so trigger points actually cannot be stretched out. They do need to be manually stimulated, either with a physical hands-on manual approach with neuromuscular therapy, injections, some doctors' offices will do injections, and then the really stubborn ones, they do functional dry needling, with physical therapy. So that's where things kind of go hand in hand. But I guess the most important thing to know is that you aren't just relaxing for an hour on our table. While deep tissue massage can be relaxing and can be therapeutic, usually if those trigger points that are causing your pain are generally worked and not specifically targeted, you can actually have more pain after you have your massage, and you can kind of feel beat up the next day and just are more achy and more pain. Whereas the specific targeted approach really helps to cut that pain cycle and relieve the trigger point.
Right. One of the things I guess that I appreciate with you guys is that, again, you walk into massage chain and they're going to say, where are your trouble spots? Mm-hmm. And they're going to kind of go through maybe the same routine flow. Depending on what you ask for, the pressures may differ. Mm-hmm. But when you see somebody, they come in, you're doing a whole subjective background, and then you're doing an assessment. And so you're not just going to sit there and say, okay, yeah, well, let's do your neck because we know most people like their neck done. You're doing maybe the right side of the neck because it's going to feed into maybe the left side of the hip. And that's something you're going to gain from your assessment that I don't think a lot of massage therapists will go above and beyond. And I think that maybe kind of stands out for me as some of the differences that you guys do.
Sure. Yeah, no, absolutely. We look at the whole body, the whole functional chain, the whole body versus just where you're having pain. Obviously, when you come into us, if you have acute pain, we're going to be working that area because that's why you're coming to see us. But we don't want to just make you feel better for an hour or a day or 2 days. We actually want to look at a long-term solution. The majority of pain patterns that we see are a result of, years and years and years of accumulation. And maybe there was just one thing that happened that just caused the muscle, to the trigger points to activate and tighten up. And, it's going to take a little bit of time. Usually we recommend a couple of sessions that people come in and, specifically target those trigger points. And we're working to correct the muscle. I think that's the biggest thing too, is that it's not just general work. I mean, we're actually actively wanting to correct, the pain pattern and the issue. So sometimes it takes, repetition. Just like, you go to the gym, you're not going to see huge difference, in one session at the gym. It's going to take going there 3, 4, 5 times. So yeah.
So tell me a little bit about, you mentioned that you're talking to physicians, OBs, providers. Then that kind of falls into what we would classify medical massage, so to speak. Tell me why why is that?
So
kind of set, I guess, kind of why is it important to set yourself different than that?
Sure. So, so medical, there is a big term right now with medical massage. And really the definition is, medical massage is someone who has more specialized training than traditional massage therapy that targets medical conditions. And neuromuscular therapy kind of fits in that umbrella, just in separating the fact that we're working on medical conditions, not necessarily, just, relaxation for an hour. But yeah, no, it's a big, it's a big opportunity for a lot of people who have been in pain for such a long time. And we see a lot of people that come in that have been wanting this type of relief and wanting this type of therapy from regular traditional massage therapy that just haven't found us. And then they get so excited that, that they can finally get relief, and they, and as a complement to other things that they're doing as well.
Yeah, we definitely refer a fair bit to you guys. And definitely from the physical therapy world. I think that when you're able to combine, okay, physical therapy is going to cover some of the soft tissue stuff. We're going to maybe do some instrument assisted soft tissue work. Maybe we got some dry needling that we can do. And then we're really going to try and hammer some corrective exercises to kind of change the patterns that folks present with. But it doesn't always fit the bill. Some people need more time, and to have an asset like you guys to do that, where we can say we speak the same language, we can go in and say, okay, I see X, Y, and Z here. This might benefit here, and then have someone who gets the opportunity to spend an hour to an hour and a half with somebody strictly on that tissue work, because some people need it. And unfortunately with the medical reimbursement model and what we have to see, and plus we want to get that exercise side down, we may not have the ability to commit that much time.
Correct. And that's why I was talking with Eric about the fact that the mutual patients that we have together really do progress faster, and that's what I see, because they're able to come in, get a little bit of the soft tissue work done here at Chandler Physical Therapy, along with the strengthening and the functional repatterning, but then they can go to our office and have a full 30, 60, or 90-minute session just on the soft tissue to really help propel their progress forward. You can do exercises all day long, but if the muscle still has trigger points and is restricted and doesn't have the correct movement, you're only going to go so far. So yeah, and the great thing too, massage, but unfortunately insurance does not see us as a necessity. So we are cash pay, but the good part about that is that we are not limited by insurance. So we can work anything that we feel is in your tissue. We can work any part of a global pattern that is contributing to your pain. We don't have to answer to insurance companies, limiting your care and also limiting your number of sessions. So we truly have a customized approach when people walk through the door.
Now with HSA cards or things like that, is that something that can be used at your facility? Yes,
so we do. We are a medical processor as far as our terminal, and HSA funds, we can run them for sure. Every HSA has a different requirement though, so you need to check with the administrator and see if a physician's prescription for medical necessity is required as far as those funds, being actively used. But yeah, we definitely see a lot of people using their HSA funds, or even flex spending from their employer with a physician's prescription. So yeah.
So you mentioned you got a couple of therapists on board. Not all of you guys share the same approach, or you have different treatment styles.
Correct.
You maybe introduce your other therapists,
Sure.
and specifically, kind of what are their strengths versus you guys?
Sure.
You all kind of come together for a little different piece of the puzzle.
Yeah, for sure. So I have another therapist on staff. Her name is Melissa. She is actually our fascial connective tissue specialist. She is an amazingly gifted therapist with connective tissue. All around, she's gifted, but that is definitely her specialty. She fascial release, which is an extension of structural integration. She focuses on looking at the connective tissue patterns that need to be corrected in order for the muscle tissue to move within proper biomechanics to move correctly. So muscles can only move within the space that they're given by the connective tissue, which surrounds all of the muscle. And if they can't, if that fascial envelope is too tight, you can do all the muscle work, and, a range of motion and whatnot that you want, but it's going to be limited. So what she does is she looks at those patterns of, maybe you're always holding your shoulder in, maybe you're always, slumped forward, maybe your leg always, rotates out a little bit. And she goes in and she changes and she elongates that connective tissue so that your joints have more range of motion and the muscles can move better. And that's, myofascial is regionally specific. So just working a shoulder, just working a hip. If you want to look at full body posture realignment, then we have the structural integration series. She does KMI structural integration, which Tom Myers anatomy trains. You may have heard of that. That's his program. She actually studied with Tom, and she does some teaching assisting with him as well. So she's excellent with that. She also does prenatal massage. That I have on board is Holly. Holly is also a certified neuromuscular therapist, the same program that I came from. I actually know her from that training program. And she brings a lot of different modalities, to the table, literally to the table. And she has an interest in pain science, and is very introspective with her work. Also really great with biomechanics. And one thing that she really likes to do is she does our integrative neuromuscular therapy, which is different than traditional neuromuscular therapy, which is just specifically muscle and trigger points. The integrative program that we have for neuromuscular work also works the nervous system. So there are quite a few people that maybe their nervous system is hyperactive, just overactive, or because of trauma, because of biosocial considerations. They do not respond well to deep work, and so a chronic pain, fibromyalgia patient.
Absolutely.
And so we've developed this program where she is able to use her different techniques to calm down the nervous system so that the body can accept the work that we're doing and not fight us. So that has been really, really key for those populations. She's seen a lot of great work with that. Lymphatic drainage, and she is just all of those regards. And then she also has training in orthopedic massage and craniosacral. So she mixes a bunch of different things into her program. So, yep. And then we continue to grow. I'm getting ready to hire another therapist as well. Demand has been good. So, growing is good. It's really exciting. Both Melissa and Holly have been with me for, let's see here, Melissa's been with me 7 years now, and Holly's been with me 5. So a lot of longevity in our office, a lot of experience, and we just love what we do.
Absolutely. Yeah. Very diverse approach. So one thing that she won't tell you is that their office was voted the best place to get a massage by Phoenix Magazine in 2015.
So 2014. Yeah.
Okay.
So Phoenix Mag, thank you. Yeah. That's 2014, we did receive Best Massage by Phoenix Magazine. And then again last year, 2016, Arizona Foothills.
Awesome.
Yeah, Best of the Valley there as well. So we were very, had a lot of people voting for us, and that was very exciting. So absolutely.
So thank you so much for taking the time.
Yeah.
If you guys do have questions, I'm going to pull up a screen share here real quick of the information, and you guys can always contact us, or you certainly can contact Rachel directly. And if this sounds like something that you are interested in, please don't hesitate to get a hold of us in any way, shape, or form.
And I'm also going to throw a promo code out there for you if you're interested in coming in for either a 60 or 90-minute session. I will give you a promo code. Let's do first 10. So $10 off your first session, either 60 or 90-minute. And mention that promo code, and we will take $10 off your session.
Awesome. Thank you so much.
You're welcome.
We'll talk to you soon.
All right.
Thanks.
Sounds good.